let's get down to the real business of taking care of the people.
We can't have a testimony without a test. And we are being tested whether we have courage enough, conviction enough, people power enough to stand up and do what is right for ourselves and generations yet unborn. Come on. And now we gotta leave this place and really do the hard work. And it is good for the family to get together, to be refreshed, to be renewed. But we have to go back and do the hard work. And whether that is you yourselves running for office or supporting somebody, whether it's you deciding that you're gonna adopt a school or adopt a student. See, none of this stuff is complicated. It is very simple. You see, titles are good. They get your phone calls returned. They get you in the room. Titles are good, but purpose is better, baby. Purpose is better. Purpose is better.
Well, welcome Dr. Javad Aghaloo to the Nina Turner Show on the Real News Network.
Excellent, thank you very much. I'm very excited to be here.
I'm very excited. So we're here together at the People's Summit, which is how I met you. The name of your organization is SAGE, and it's a nonprofit organization that provides free dental care to a primarily rural poor population that borders Arizona and right on the tip, 60 miles, I think, from the Arizona border, and right there on the tip of Mexico. What motivates you to do something like that?
Well, I saw the area. It's very medically and dentally depressed, highly Hispanic, low income, a lot of children with no dental care, and a lot of medical and dental needs. And I couldn't take the fact that a lot of them didn't have any dental insurance coverage.
How was this brought to your attention? I mean, you're a practicing dentist. You just woke up, an epiphany, you heard the voice of God. I mean, talk to us about what happened,
That's
what
a great
motivated
question.
you?
What I saw, Nina, was I saw that the Medi-Cal, which is Medicaid, it covers some dental procedures, and I take that at my office because I want to provide as many services to as many people, but the Medi-Cal simply wasn't covering very many services at all. And the ones that it did cover, they had to pay out a lot of pocket. The patients had to pay money out of pocket that they simply didn't have. And so they either had to wait for a very, very long time through an approval and an appeal process, or they simply didn't get the treatment and they had to leave with pain, infections, and so forth. So,
and why is dental care? Because in a lot of even the medical, even the healthcare reforms of this country, we don't actually talk a lot about dental care. What does the new science say about why dentistry or taking care of our teeth is very much relevant to high blood pressure, diabetes, heart, all of that? Why does that matter?
Again, very relevant question, Nina. So if you have infection and disease in your mouth, obviously you have infection and disease in the rest of your body. The mouth is a window to the rest of the body. And so the same plaque, the same actual bacteria that's in your mouth when you brush your teeth every day is the same plaque that clogs your arteries and causes heart attacks and strokes. So if the vessel goes to your heart, it would cause a heart attack. If it goes to your brain, it would cause a stroke. It also makes diabetes much worse. If you're diabetic, you're much more likely to have gum disease. And now there's many studies that show if you have gum disease, you're more likely to have diabetes. So just huge, massive effects.
And why do you think, especially where, the majority of Americans, no matter what they label themselves right now, a lot of the polling says that people in this country really want to see Medicare for all. Dentistry is kind of being left out of that. What would you say as a doctor, as a dentist, Dr. J, right? Dr. J, what would you say to policymakers as to why making sure that dentistry is embedded into everything that we do to lift up the healthcare options of the people of Americans?
It absolutely has to be included in Medicare for all. It has to be, because the mouth is connected to the rest of the body. And like we said, anything going on in your mouth, you see it in the rest of your body. Just having gum disease, simple gum disease, it causes inflammation throughout your body. So like you said, increased blood pressure, coronary artery disease, forms of cancer have been linked to plaque in your mouth. So I don't know why they haven't considered it, but it sure needs to be considered.
And all of this that you're talking about is preventable.
Absolutely.
Right. So we can really invest that money on the front end to make sure that people are safer or healthier, I should say, on the back end, which would actually save us lots of money.
Absolutely.
As a nation.
One of the things that I go out and do, and my staff, is we provide a lot of education to not only children in schools, but a lot of the parents.
Yeah.
A lot of the parents aren't educated on this subject. They just think that everything's fine, and if their child has a toothache, they just bring them in for that one emergency. Another thing that we're doing with Sage is we're not just providing emergency care. We don't just want people to come in if they have a big swollen infection or they have a toothache.
Yeah.
We want them to get all their treatment done and keep on coming in for preventive care, like cleanings and checkups and exams.
And we should get cleanings every 6 months.
Every 6 months, absolutely.
Okay. No, Doc, I am just so fascinated by this because we are in this moment that the nation, our nation, is really laser focused on healthcare and healthcare reform. And to me, this is the moment. And to have someone like you that is dedicating both your, I would say, your professional life, but that you also feel that this is a moral obligation.
Absolutely.
And you're serving a purely poor Hispanic, maybe not exclusively, but the majority of the people that you're serving right now are poor Hispanic families who are just trying to live a good life every single day.
That's all they're trying to do.
And you're helping to bring life to them through dentistry.
Trying to, yes.
Dr. J, you are all that. You really, really are. And we need more like you. So this is a nonprofit.
Yes.
So you raise money to be able to provide these services.
I feel so lucky to have staff and volunteers that have my same vision. We actually came to it together. So a lot of it's volunteer. We have a lot of, we've written grants to the state and federal. We've done fundraisers and trying to get donations, but it's very difficult.
Okay.
So up until now, it's been self-funded. But I have luckily have so many volunteers and so many people.
So you're giving your money, your time, and your expertise along with other folks in the industry. So whether it's the dental technician, everybody up the chain, because a dentist, you need your person by your side, the dental hygienist.
Absolutely, yes.
But you have motivated and inspired people to give up their time to be able to provide these services to our sisters and brothers in need.
Yes, we have.
So Dr. J, the fact that you are really using your time, your talent, and the time and the talent of other people to provide a service to communities in need is really a big deal, and we need more people to do things like that, to give of themselves. Is that one of the reasons why you're at the People's Summit?
That's absolutely one of the reasons. I try to spread the education and the knowledge in what we're doing, and I tell a lot of other providers that if all of us can come together and at least do something, rather than just a few of us doing a lot, I'm giving everything in this. I'm working 7 days a week because I'm seeing a lot of these patients on the weekends. So I'm trying to meet other people that are like-minded, and I'm trying to spread the fact that we need to have dental care included in Medicare for all, and just go from there.
You're really just building a community of people who are willing to do just what you're doing.
Absolutely.
Dr. Javad Aghaloo, thank you so much for joining us on the Nina Turner Show on The Real News. And thank you all for listening to us. Hopefully your hearts and minds will be touched, that you can use your gifts and your abilities and your skills to make this world a better place in the space where you are. I am Nina Turner, and you have been watching the Nina Turner Show on The Real News Network.